Uterine curette. So this is a uterine curette to scrape out and suction uterine lining and to treat AUB and remove product of conception. This is vaginal speculum, or you can say cuscus. So this is a self-retaining sort of retractor, which is bivalve speculum. It opens like a duck and it's for vaginal and cervical examination. This is Myoma Screw. This is an instrument with oval handle and a screw head. The use of Myoma screw is for traction. Myoma screws are especially useful in mobilizing large fibroids and when fibroid uteri are incarcerated in pelvis. Uterine sound. It is used to gauge the depth and the position of the uterine cavity. From the 5 cm from the tip, it is 30-degree bent, and it is also helpful with the placement of IUDs and verification of the intrauterine position and the length of SHG cannulas to be used. Simula Speculum. It is inserted into the vagina to retract the posterior vaginal wall. It gives more exposure of the vaginal wall than the cuscus speculum. It comes in various sizes and it can be single blade and double blade. Leach-Wilkinson's cannula. It has this conical tip and it is mainly used for histoselfangiography and mainly used to inject dyes. It is available in various sizes and this conical tip goes into cervix. This is metal urethral catheter. It has this eye at the tip and it is mainly used to drain the bladder during the surgeries. So from this eye you can drain the bladder. Bladder Sound. It is a long instrument with gentle curve. It's not like uterine sound and it has no marking on it. It is used to define the extension of the bladder cystocele and vaginal hysterectomy. It is available in various sizes. Valsalum. It is an instrument which is used to hold the cervix after opening the vault of the vagina and to give the traction. The main role of this instrument is to hold the cervix so that you can perform the surgery and to hold the cervical stumps. Heggar's dilator. It's a long rod-like instrument with gentle curve and tapering tip. It is used for dilatation of cervix in procedure like DNC, DNE, hysteroscopy and all. Episiotomy scissor. It is also known as Lister or bandage scissor. So there are two names, Lister scissor and bandage scissor. It is used for giving episiotomy. Cervical punch biopsy forceps. It is a forceps which is used for taking the biopsy sample from the cervix. As you can see, there are holes in this forceps so that you can take the tissues out for biopsy. EB cannula. So this is the EB cannula. As you can see at the tip, there are some sharp edges so that you can take the endometrial sample for biopsy, and from this tip end you can attach a suction as well. This is air spatula. It is used for taking the pap smear for screening cervical cancer. It is made up of wood so that cell can adhere to the porous surface. The long end is inserted into the cervical canal and it is rotated in 360 degrees. And the broad end is used for obtaining cells from the lateral vagina for knowing the hormonal status. This is umbilical cord clamp. It is used for clamping the umbilical cord of the fetus. It is a disposable one. This is cervical brush, or you can say cervical broom. It is used for HPV testing in conventional cytology and liquid-based cytology. This material of the brush is made of hydrophobic material, and this facilitates the release of the cell material into the fluid or onto the gas slide. Copper T. I have two copper Ts over here. Copper T 380A. As you can see, it's for 10 years. There is a T shape. And another one is copper T 375, which has this curved ends, as you can see. And it is for how many years? Please comment down below. So next is this endosampler. As you can see, one syringe is attached to this plastic sort of tube. So from this tube you can aspirate the sample from endometrial cavity. Carmen's cannula. These are the cannula which are used for MTP. So how do you use them? You will connect these cannula to the suction and then you can aspirate out the conceptus product. So these are used for MTP, medical termination of the pregnancy. So they are available in various sizes, as you can see over here. And there's at the tip there are two holes and sharp pointed end, so that you can facilitate the MTP procedure. Histoscope. So this is a complete histoscope, operative histoscope, so that you can visualize the uterus. Histo means uterus, scope means visualization. From this point you will insert the instruments for operation. This is diagnostic histoscope. Earlier one was operative histoscope. It is only for diagnosis. Copperty removal hook. As you can see, the shape is very much similar to the uterine sound, but it's very much different because at the tip there is a hook which is used to remove the copperty. But if we'll see the length and the size, it's more like a uterine sound. Shirodkar clamp. It is for holding the uterus. Vaginal packing forceps. This is for inserting the packing gauzes into the vagina. Doyle's retractor used during LSCS, protect the bladder from injury. So this is all for today's video. If you find this video informative, please do like it, subscribe to my channel and share it as much as you can do. Thank you so much.